Hi everybody, welcome to another Chats with Chaudhry. I hope you're safe and well. Today I'm delighted to be joined by Martin Gilar, who is a scientific fellow at Waters Corporation. And today we're going to be talking about oligonucleotides, diagnostic probe purification analysis. So Martin, it's lovely to see you. How are you?
Good, how are you?
I've been better, Martin. Lots of technical problems today, but hopefully they're all resolved now. So it's lovely to see you. You're calling you from, well, not Boston, but near Boston, I understand.
Yes, I'm near Boston. I'm in Milford. That's where the Waters is located, and Waters R&D is located. And it's in Massachusetts in USA.
Fantastic. Well, before we start talking about oligonucleotides, perhaps you could tell people a very quick overview of Waters and your background.
So I am an analytical chemist and receiving my PhD from Czech Republic, the University of Chemical Technology, Institute of Chemical Technology. After that, I moved into US and worked for a company that was developing nucleic acid-based drugs. That was my first exposure to oligonucleotides. And then I spent some time at Northeastern University. I expanded that expertise. So when I joined Waters, who is a manufacturer of liquid chromatography instruments and columns, I was developing methods for analysis of nucleic acids and oligonucleotides. And it turned out that those methods are now very popular in the industry.
Fantastic. So let's start off with a very basic question. What are oligonucleotides and why are they so important?
Very good question. So oligonucleotides are short pieces of nucleic acids, either DNA or RNA. And they could be either used in a diagnostic industry or as a therapeutics, as I've mentioned. Lately also, mRNA vaccines are large chunks of mRNA, and they are analyzed by chopping them into small pieces, oligonucleotides. And all these methods that we developed years back are now useful even for this type of analysis. So oligonucleotides are small pieces of DNA.
Fantastic. All right. So can you describe briefly the principles of ion pair reverse phase chromatography for oligonucleotides?
Good. So one of the methods that we developed is based on ion pair reverse phase chromatography. And because nucleic acids are very, very polar and they are not retained in this classical reverse phase chromatography, we add ion pairing agents into the mobile phase.
Right.
And that converts this reverse phase chromatography into like a quasi-mix mode where the oligonucleotides are retained not only by their hydrophobicity, but also by their charge. And that causes better attention, and as well as it is adding to the selectivity. So oligonucleotides are better resolved by their length.
Right. Okay. So what are some of the key challenges though with IPRP when analyzing and purifying oligonucleotides?
So one of the challenge is, let me describe it like this. If you have a 10-mer, meaning it's a oligonucleotides consisting of 10 mononucleotides, 10 monomers, and 11-mer, the difference in length and charge is 10%, and we can easily resolve those two species. If it is a 50-mer and 49-mer, that it's becoming more difficult, and 100 and 101-mer, it's just 1% in charge and length. It's very, very small. So the peaks allude very closely to each other. It's very hard to resolve them. So that's one challenge. If people are dealing with typical therapeutic oligonucleotides, let's say 20 to 25-mer, life is good. You could do a really good job in separation and purification. If, however, the interest is in higher and larger oligonucleotides, then the separation of so-called N, the target product, and N-1, the first shorter impurity, that could be very, very challenging. And that requires really a good system and good high quality column.
Right. Okay. So can you do LCMS analysis though when using IPRP?
Right. So that could be one of the other challenges, right, in ion pair reverse phase chromatography. In classical systems based on, let's say, triethylammonium acetate, where the mobile phase is composed of amine, triethylamine, and acetic acid, the LCMS sensitivity is really poor. Even though the mobile phases are volatile, the acetic acid suppresses the ionization. So converting this into a LCMS compatible method, we stumbled on several solutions, and one of them is replacing the acetic acid in the mobile phase buffer by hexafluoroisopropanol, which is one of the mildly acidic fluorinated alcohol that acts as an acid, and it's so volatile that it doesn't suppress the ionization of oligonucleotides. So now we have a set of mobile phases that act as an ion pairing mobile phases, and they are very well compatible with LCMS. So the signal, you can get not only UV detection, but you can get a mass spec detection. That's what it is.
Right, okay. And are there other ways that scientists can overcome these challenges, or would that be the main way?
Obviously, there are multiple ways. You can turn into other methods like electrophoresis, but that was very difficult to connect and hyphenate to mass spectrometry. So mostly it's ion pair reverse phase chromatography if we're talking about LCMS. If it is just a separation that people are interested, obviously the ion exchange chromatography could do well. Electrophoresis can do also well. Classical slab gel electrophoresis will do a decent job, but I would say that all of those methods are now being displaced by ion pair reverse phase chromatography, and the tricks how to do it well really depend on the expertise. There are luckily enough of papers now published in the peer-reviewed literature that will guide users to the really the best methods that they can use.
Fantastic. So you mentioned briefly at the very beginning about the vaccines. So oligos are used as probes in the RT-PCRs, and obviously the RT-PCR is used primarily for COVID-19 diagnostic tools. So are those probes purified by IPRP? And if so, what are some of the unique challenges and strategies for purifying them?
So there has been visible a resurgence of interest into this diagnostic method based on the nucleic acids. Real-time PCR. Real-time PCR uses the dually labeled probes. Those are pieces of oligonucleotides that are complementary to some viral RNA. And those diagnostic probes are labeled with quencher, that is basically quenching the fluorescent or basically light response from the probe, and the dye itself. And one of the main problem in the diagnostics is to prepare these high quality probes. They are prepared synthetically, by the way. Oligonucleotides are often prepared synthetically. We know how to synthesize short oligonucleotides and even up to, let's say, a couple of hundred mers, but typically short ones. These nucleic acid probes, diagnostic probes, could be 15 to 25 mer long, but they are dually labeled. They have those two dyes attached to them. And if any of those dyes is missing, or the sequence is not what we want, it's compromised, then the diagnostic method will not work satisfactorily. So to ensure that these diagnostic methods work well, we need to get that specific oligonucleotide specifically labeled with those two dyes, and all the impurities should be removed. This is done typically. Chromatography is preparative method. You could purify substantial amount of material. It could be very, very pure. So we use this ion pair reverse phase chromatography to purify these probes. There are even papers that we published in like 2003 for purification of Tachman probes, again, diagnostic probes. And basic principle is you're gonna get a decent separation, and then you're gonna collect your main peak, and you're gonna get your milligrams to few hundred milligrams of material. That is enough to satisfy basic diagnostic methods. And if this is really a really large scale purification, we might be talking about half a gram of material, but that the method is so sensitive that we could do worldwide with that amount of material and do a decent diagnostics. So the diagnostic industry now is really using these semi-prep or prep columns. They use the ion pair reverse phase method for purification and then for quality control of the final collected fractions. And it seems to work rather well.
Fantastic. Now, I know that's all we've got time for. So if people want to get more information about what we've talked about today, where can they get more information?
There are obviously a large amount of literature. We are as guilty as anybody. We have published 15 plus papers about oligonucleotide analysis, purification, LCMS. Then, of course, Waters has application note library. We have 100 plus application notes about specifically oligonucleotide analysis. Those are usually short information, 2-page document that will spell out exactly how we do things.
Right. And have you got any events coming up at all which might help people as well?
We have several webinars ongoing. One of them is on March 31st, Spotlight on COVID. We will talk about diagnostic probe purification specifically.
Fantastic. Well, Martin, thank you very much for your time today. If nothing else, I've learned how to pronounce well, I thought I could pronounce it, but I've now stumbled over it, oligonucleotides, and learned a lot more about that. So, I read a lot about it, obviously, relating to the vaccines has come up a lot in terms of a lot of articles over the last 12 months or so. So it's been really interesting to learn more about the whole subject, actually. So thank you very much
for
sharing that information. Yeah, and so viewers, if you'd like to know more, then as Martin has said, there's lots of information that Waters have provided in terms of white papers and application notes, which you can access with the links above the video. There's also the webinar that Martin is actually presenting, I think, if I'm correct, Martin, on the 31st of March. So you can hear Martin expand even further on what he was talking about today in the webinar. And again, the link for that, and it's free, will be above the video as well. And if you've got any questions for Martin, then feel free to put them below the videos. I'm sure Martin will be only delighted to answer any questions you might have around what he's talked about today. So Martin, all the stuff he says, thank you very much for your time. I really appreciate you sharing your wisdom and your knowledge with me. Thank you very much.
Nice talking to you, son.
Right. And so, Martin, I wish you, your loved ones, everyone at Waters, a fantastic 2021. I hope it's successful and, more importantly, healthy and happy. And viewers, as I said, please check out the links above. Feel free to leave Martin any questions, and have, as always, a wonderful month, and stay well and stay safe. Bye-bye.
Bye.